here, and sorry I was a tad late, but just trying to get some other things taken. I'm going to be teleworking today after this meeting. My roads are still pretty much blocked and got a lot of snow. But anyway, uh, um, I see Kenneth with us. Good to see you, Kenneth. Let's see. Is Tyler? I'm trying to look for Tyler. Oh, there you are, Tyler.
Yes, sir. I'm here. How are you?
Oh, good. Good morning. I
Good
just
morning.
just want to welcome everyone, and if there's anyone here that this may be the first time you've been on this particular reentry council, give you an opportunity to introduce yourself and tell us a little bit about you. T. Thomas.
Yes. Good morning. My name is Thais. I'm with West Virginia Workforce, the West Virginia Proud Grant. You may have met Wes Hoffman. So he and I actually do the same thing. I just started, and he's out on sick leave right now. So this is my very first Reach meeting. Hello, everybody. Um, so I'm just kind of here to observe today, and
Cool.
we'll have
Glad,
more
glad,
input probably next time.
glad to hear you. Now, are you one of the, I know that we was talking to Philip.
Mhm.
They're adding more agents, I guess. You're one of the newest agents in the state?
Yes. I'm a reentry coordinator
Great.
for I'm Region 6. I'm up north with well, actually me and Wes are in the same office in Morgantown.
Okay.
So
So how many left are there? I know Philip is here too. So how many do you have left to fill? Are they all filled?
Yeah,
there's one
one more.
more.
One more. Okay. Well, that's good. And have Philip scheduled to kind of give us an update in April. Is that still good, Phil?
Yes, sir. That's still good.
Okay. Yeah, I'd like to hear how things are going. You guys are making a lot of progress, and just to have something like this that is dedicated towards reentry is amazing. So it's really good. Um, what I thought I'd do is before we have Tyler present that, give Kenneth an opportunity to speak to some uh, training that's coming up next month. It's been announced, the Reach Initiative announced it not too long ago. I think it was yesterday or so, and it's scheduled for February. But wanted to give him an opportunity to make that announcement. I do want to first say, we've been busy doing other things. I know Christia has been doing things, and I want to let you know I've been trying to help some individuals get home plans. Um, and we were able to get one individual home plan. The individual was approved for parole last week, and so now it's a matter of them. I guess they have a 30-day hold before the person can be released, but they're right now going through his home plan. But we were able to help him get a home plan with a organization here in Charleston. Some of you may have heard of it. It's Family Support and Rehabilitation Services. And so they were able to give him a home plan. So we're hoping right now that his home plan will be approved and that he'll be released here probably in the next month. He's excited about it. And I'm also working with another individual, trying to see if we can help him with a home plan as well. Um, so this is one of the things that we try to do with the reentry councils is to assist people in these types of situations. So, and I think also just want to remind everyone that the legislative session begins next month, right around this time next month, and there's going to be quite a bit of relevant legislation as it relates to reentry. And we had a presentation last week from um, from a young man who's working with the American Friends and Service Committee, and he advocates for and and against bills that that are favorable or unfavorable. And so we're going to try to keep everyone abreast as to what bills are out there, what we can do, to call on legislators and just express our interest or displeasure with things that are being considered by the legislature. So we'll keep you informed about those things. So I think at this time, well, first of all, is there anyone else that's done, this is your first time on this reentry?
Be my first time, but we're also presenting, so I guess you get to
Okay.
see both of us here shortly.
All right, very good. And I see a Deborah Ujevic, if I remember correctly.
Yes, thank you. So I wanted to, and I was actually going to reach out to you privately, Reverend Sylvia. I'm with the ACLU West Virginia.
Right.
I'm also a lobbyist. I'm not sure if you said had somebody from the American Friends Service Committee. I'm thinking that maybe Kenny Matthews.
Kenny Matthews he spoke
Yeah,
last month.
yeah, he's a good guy, and like we work really closely together.
Mhm.
I also am happy to do any presenting or anything you guys might need to prepare for legislative session. And the other thing I wanted to mention is that we're starting to get some information about like what's going to happen and like leadership and things like that. And this is going to, it looks like they're going to be a big push for the death penalty this year. They introduce a bill for it every year. It generally hasn't run, but based on the committee leaderships and stuff like that, we've got some people who are very enthusiastic about it. And this might be the year they have the votes, so it's going to be really important. I'll do my best to keep everybody informed because I'm going to be at the Capitol every day, about when, because what they tend to do is whip these bills out in a surprise move and jam them through. There's been some procedural changes where in the House of Delegates they're not going to be able to do that. They're going to require more deliberation, so that'll be very helpful for
Right.
us to get the public in there. But again, Reverend Sylvia, I was going to reach out to you privately, and like I said, offer to give anybody any help they need. If you want another workshop or whatever, I'm happy to do that. And again, wanted to sort of get it out there and in front of everybody that we really expect a push for the death penalty this year. So it's something we need to be kind of prepared for, have something in our back pocket, you know what I mean, in order to be able to come to them and say, advocate against it.
Right.
We do expect a lot of defensive positions this year because of, because of just like the makeup, a lot of very, very, very conservative people. But
Right.
we do anticipate we do see some paths for reform. We're not going to let up on that. But so like I said, these are just some things I wanted to mention. And, as we run up to legislative session.
Right. Well, I appreciate that, Deborah, and definitely, I think you have my contact. I'll put it in the chat, and you should have my email as well. But definitely would like to keep in touch with you. I know that you're going to be active as well, following the legislature. For those of you who may not know, normally today would have been when the legislature would begin. But because we had after every general election, they normally start the legislature in February. And so we had a general election this past November. And so instead of the legislature starting today, it's actually going to start this time in February. So that means it will go further out. I do have March open. I wanted to kind of keep March open just to allow some flexibility to see if there's things going on legislatively that we might want to speak to. And I do have a John Kangas for next month. And then Lyda Shepherd will be doing what she's normally done for us in May. She'll do a legislative update because the session will end in April instead of March this year. So we'll keep everyone informed, and Krista may be able to send out any announcements in between meetings. If they're really important and significant, we can get the word out that way as well. So in any case, I appreciate that, Deborah, and I want to at this time give Kenneth an opportunity to give an announcement. Then we'll have Tyler. This is an important training that's coming up next month. I'm dealing with recovery coaching, and for those of know that reentry and recovery go hand in hand, and so Kenneth, if you would maybe just speak, however long you need to just kind of give an idea of what's going to be happening next month.
Absolutely. Thank you, Pastor Silva. It's good to be back. It's been a while since I've been on the Reentry Council meeting. I'll try to start making more of a emphasis to be back, but I took a new role. My current role, I am the project director and coordinator of the West Virginia Peer Training Hub through Marshall University Center of Excellence for Recovery. I work under the MERC banner, which also stands for Marshall University Research Corporation. So I'm basically over the whole state with peer development when it comes to training development. A couple things that we have coming up that individuals probably should see in the chat box. Miss Spears uploaded some PDF files of the flyers there, I believe, if you want to download it. First thing is tomorrow we have the Peer Perspective webinar series. We have partnered with and developed the curriculum, co-developed myself, and it is called the Peer Perspective. So it is the second Thursday of every month for the next 10 months. And tomorrow, if you would like to maybe attend that, scan the QR code to register, and you will see a link underneath to actually put it in the web bar to attend it. All the sessions will come with either 1.5 or 2 CEs each. Now, the first one is HIPAA compliance, mainly geared toward peer training for as our state certified peers, and again, any kind of peer recovery coaches. Also, there are individuals that probably maybe be on here that are under a grant, and usually grant positions require that you have HIPAA compliance training. So you could also attend this as well to get credit for that. Now, February 13th, which will be next month, is one that a lot of individuals that's on this meeting today might want to attend as well. So myself and Chad Sabara, we have co-developed a curriculum that he will be presenting on, and it is a peer's guide to navigating criminal justice involvement and overcoming barriers, supporting participants in the system. So basically what we have developed is the legal process for expungement, also understanding the rights, overcoming the barriers. So we have put a thorough presentation with a manual together for this. So February 13th, I will probably get that flyer developed within the next 2 weeks, and I'll get that sent out to Miss Spears. Hopefully she can get that out to everybody as well. But that would be very good for a lot of people that's involved with persons that were formerly incarcerated, justice involvement, or from reentry. It would be excellent training for everybody to go to. Some other things that we have coming up, we have the peer recovery coach training, or the PRSS training, next month. Jason Wickline is the individual and instructor for that specific course. Jason is an excellent instructor. Myself, I may be having a more closed door training February 24th through the 28th. I haven't decided that yet. I'm really kind of bombarded with a lot of trainings, and kind of, my schedule's full up till July, but I've been having large requests for that. For me specifically, I have revamped the PRSS training, and I work close with the West Virginia Certification Board of Addiction and Prevention Professionals located in Dunbar, West Virginia. And there's a lot of moving parts that's going on right now. But with me, I have more of a college-based style class that I teach. Obviously, I have extensive training, not only from a state and regional, but also from a national level. I kind of come from the Susie Mullins tree, if anybody knows Susie Mullins at all. And I've just kind of developed over time within. But I am geared more toward day 4 when it comes to working with reentry. I am all about bringing entities throughout the state together to provide professional development for our peers and to help our reentry population. So during that, not only do I give my presentation and go in thorough exactly how it is for peer and peer support when it comes to working with reentry, But I also bring other entities in because we want to develop our peers initially and give them the best opportunity for development and to provide support services for our reentry population. So I'm more thorough with my classes, go very in depth, and I truly teach them the scope of work of being a peer and what all that entitles. There's been a lot of good reviews with my classes, and again, I guess that's why I'm getting a lot of requests. But Jason will do a good job as well. Jason is charging $100 per person. That is pretty cheap compared to other, and the reason is that we paid for his TOT training through Marshall. So we had all of our TOTs to sign an MOU contract because we have some peers out there that want to charge some outrageous numbers. So we wanted to be fair for not only individuals for their time, but also fair to the individuals that may not have the means or the money. And if they do seek a scholarship, it's minimal payment. But I will be sending, again, some materials over to Ms. Spears about me possibly doing a class February 24th through the 28th. That will be at Marshall University South Charleston campus, which is located directly below Bridge Valley Community and Technical College. That is our undergraduate and graduate students when it comes to the medical field for Marshall. Now, January 15th and 16th, I have the 16-hour PRSS Peer Ethics course that I will be teaching at the Marshall University South Charleston campus. For me, again, I go in a little bit thorough. Not only do I teach individuals from ethical and moral perspectives, the basic concept is iatrogenic ethics, you have fiduciary ethics, boundary management, and on top of that, multi-party vulnerabilities. But I take it one step further. I'll also teach them personal ethics, professional ethics, organizational ethics, legal compliance, legal ethics, and I kind of give a very thorough training again, and it better suits them and sets them up from an ethical perspective, right? And again, that's 16 hours, and that will be January 15th and through the 16th. One unique thing about me, I am a graduate from Bridge Valley Community and Technical College, but I am also a graduate from West Virginia State University with my Bachelor of Science in Criminal Justice, Court, and Legal Studies. And I'm currently a graduate student and trying to get my Master's of Science in Criminal Justice Administration, and I will be wrapping that up in July this year. So I have a lot of ties when it comes to the criminal justice system. Obviously, I'm an individual that was formerly incarcerated myself years ago, individual long-term recovery. So I'm very compassionate about this, and I know the need for individuals from the reentry perspective and also what they went through while they were incarcerated on top of that. So I'll bring this professional development within. Now, there are some other moving parts with the certification board. The PRSS has now been split up in two distinct credentials. You have the PRSS SUD, and this starts in March, and you have the PRSS MH. Again, MH stands for mental health. So mental health services is now billable through Medicaid. So that's why they have separated this. So for the initial training, for right now, the CERT board is wanting individuals to take the mental health first aid 8-hour course. Now, I also am starting to teach at West Virginia State University, and I have a connection now with the cadets up at the State Police Barracks. I also am certified to teach mental health first aid for public safety, which is law enforcement specifically. So I have some classes set up at West Virginia State through my program to offer those trainings. Also, I will send some stuff out for that. Anybody that may be along the lines of first responders, 911 dispatch, especially public safety, obviously law enforcement, we would love for you to attend those. Again, as one way that we can help the system, we have to better educate and train our law enforcement personnel as well. And there are things that they go through, and hopefully that will help with the reentry. Again, it takes time. Got to have patience a little bit. We want to continue to develop that. But that's kind of what I have right now. One thing I would ask if anybody, I do have connections as far as locations for all the day report centers throughout the state. But if anybody has a list of possible peers that are working at the day report centers, if they could email me those or put me in touch, that would be great. Because I have a lot of other day report centers that are now coming for training for their individuals that are currently in reentry, obviously. One last thing that I'll end with, we are working closely with the CERT board. Hopefully I'll become a board member within the next month. I've submitted my application for that. But I will have the SAFE project providing training for the FPS peer credential, which is forensic peer specialist. I'm hoping the CERT board will eventually adopt that credential. So what that is, a forensic peer specialist, is basically an individual that is a certified peer that works specifically with reentry. not a peer recovery support specialist that works, at a day report center. We specifically want to get a credential with individuals that are certified through a governing body that works specifically for reentry. So we are working on that currently. Okay. Hopefully, maybe we'll have something developed soon with that, but we're going to start bringing out trainings for that so that current peers can understand exactly what that entitles to be a forensic peer specialist. But that's all I have. I will put my contact information in the chat box. And if you have any ideas or trainings that you may need for your organization or entities or peers, please get a hold of me and we'll see what we can do for you. And I'm glad to be here. Thank you, everyone. Stay warm.
Yeah. Thank you, Kenneth. And Kenneth has been, he's presented before in his previous employment, and I'm glad to have you with us, and thank you for all that. Just one quick question. So you're saying there's going to be an expungement part in one of the training sessions coming up dealing with
That is correct. February 13th. It's the Peer Perspective webinar series. And again, it is called A Peer's Guide to Navigating Criminal Justice Involvement and Overcoming Barriers, how to work within the system.
Okay.
Yeah.
Yeah, we had something, it's been years though, but we had something on expungement years ago through this council, and it was very, very helpful. It was at the Goodwill Prosperity Center, and it was just when legislation had passed, and we had a good number come out, and so that's very important. Appreciate that. So thank you again, Kenneth. Appreciate that. I'm going to right now let Tyler, do you need you need access to anything, or share, to share your screen or anything like that?
I have well, first of all, good morning. I
Good
hope
morning.
everybody's staying warm. For those who don't know me, my name is Tyler Pack. I am the community engagement specialist for Pyramid Healthcare. And for those who do know me, it's a pleasure seeing you this morning. This morning, I have our Senior Director of Marketing, Tyler Frederick, with us. He does have a presentation that we together would like to collaborate and provide to everybody here. If we could give him access to the screen, that would be amazing.
Okay, so give Tyler, you got two Tylers there?
It's T.
Yeah.
Frederick.
T. Frederick.
Yeah, we make it easy for you to remember.
All right. You are now co-host, Tyler. So have at it.
Is everyone seeing my screen?
Yes.
Okay, perfect. Tyler, I don't know if you wanted to, is there anything else you wanted to kind of overview before I kind of hop in?
Yeah, absolutely. So, again, it's great to be here this morning. This is Tyler Frederick. He is our Senior Director of Marketing. We do have a recovery facility we have two facilities in the Eastern Panhandle. We are up in the Martinsburg area. I know I've talked to a lot of everybody who's in here and kind of given a quick rundown about what we have to offer, but we are a dual licensed facility where we are able to help with behavioral health as well as mental health. We provide statewide transportation. We have a 3.7 detox, a 3.5 residential program, as well as a 3.1 longer term program. We provided our main facility, the Mountaineer facility, both male and female options. And we just recently opened up a secondary location in the Hedgesville area, which is about 15-20 minutes away from our Mountaineer facility. And that is a male's 3.5 and 3.1 facility. I wanted to bring Tyler along today to kind of go into a little bit more in depth of all of the assets and aspects of our program. So that way, if anybody here today has questions that we might run into when helping get individuals placed or finding a program that's going to be suitable or form-fitting for that client, we want to make sure that we have all the knowledge of each program we're working with throughout the state. I really appreciate this opportunity, and I would like to warm hand this off to Tyler to kind of go over what we have here today, and provide all the knowledge that anybody may have questions over.
Yeah, thanks, Tyler. So as Tyler said, my role within our organization is Senior Director of Marketing. So I oversee several states in which we operate and the outreach that we do in the community. So that's in Pennsylvania, New Jersey, and most recently in West Virginia. So really the role of our teams is working with agencies such as yours just to talk about the services we have, kind of collaborate on resources that are available, whether it's something that we can help out with or connecting agencies with other services that, you know, maybe we don't provide. But that's really the primary role of myself and, you know, Tyler as well, and, you know, the other representatives that we have that operate in different states. So, you know, I want to talk a little bit about the services that we offer in West Virginia, but also I think it's important just to talk a little bit about who Pyramid Healthcare is. West Virginia is the newest state in which we operate services in. So as we go through this, if anyone would like to come off mute and ask any questions, we definitely can have time for questions in the end, or even drop some questions in the chat. More than happy, because really we just want, for those of you that we may have not met with or talked about, you may be familiar with the location in which we operate in Kearneysville, but really just want you to also understand who Pyramid Healthcare is also as an organization. So before I dive in, anyone have any questions they want to come off mute to ask? All right. So as I said, Pyramid Healthcare as an organization has been in some of the next slides, we'll kind of talk about who we are as a company, but has been in operation. We just celebrated 25 years, started primarily in Pennsylvania, Altoona, Pennsylvania, more specifically, which is actually where I'm from. So started in 1999 with one small residential and detox program, and over the last 25 years has grown to over 80 locations, over 8 states. And what's really important is just like our approach. So whether it's the services we provide in West Virginia or the services we provide anywhere, our approach to treatment services is not different, because our mission as an organization is assisting with behavioral health needs. So in West Virginia, primarily our services are centralized around the SUD population. However, in other areas, we operate mental health services, autism schools, a number of different behavioral health, eating disorder programs, behavioral health services, primarily serving the Medicaid and the uninsured populations. We do have some programs that work primarily with commercial insurance, but primarily the agencies in which we served are the Medicaid population and the uninsured population. Probably furthermore than that, within this group, probably the demographic of clients that we work with the most would be the criminal justice involved. And that is our treatment programs, as well as the clinical curriculums we use across all of our programs, are very geared toward that population, using CBT and DBT treatment in order to really work well with that criminal justice population. We also offer comprehensive case management services that really lend to working with the agencies, like some of the agencies that are on the phone today, just to ensure that we're setting up those clients for success in aftercare. Probably the other thing that is really important is just, again, we've operated for some time, and we have been able to develop processes that we can implement in new programs and new states, and really makes it easier for us to ensure that when we're entering into a new area to provide services, we're not just entering in that area to provide services, but we're providing quality services. So as you can see, these are the states in which we operate. Our largest footprint would be in Pennsylvania. We operate over 1,000 residential beds and 13 outpatient locations in Pennsylvania. At this point in time, as Tyler said, we have 2 locations in West Virginia. It'll be on the next slide, but we're also looking at adding outpatient IOP services in addition to our outpatient services that we're providing in Berkeley County. We're have some more programs opening up in North Carolina. We also operate in Georgia, Virginia, Maryland, and Connecticut, as New Jersey as well. So within those services, one thing that I think is really important to talk about is not just the demographic of individuals that we serve, but the acuity of the clients that we serve. So typically, we're a provider that works with high acuity clients. So that's your higher levels of care. That's your withdrawal management, your residential, your co-occurring individuals, and utilizing a continuum of care essentially so that we're bringing a client in and we're able to work them through that entire continuum to ensure success. You know, where that kind of stops specifically in West Virginia is really working with long-term providers with the appropriate certifications to ensure that we're really providing long length of care for individuals. Really, in West Virginia, as well as most states, we really focus in on those higher levels of care. So that's your management, your 3.7 medically monitored, and your residential services, and then step down into your low intensity residential. As I kind of referenced earlier, we have we're over 80 locations, 2,000 total residential beds. As I said, we have, you know, about 1,000 residential beds in Pennsylvania, and we have some other states, North Carolina, Virginia, that we're continuing to open up more beds. West Virginia being alongside of that, as we've now ramped up to about 150 beds in West Virginia, with plans over the next few years to probably, with the locations we currently have, to be around 250 total beds in the state of West Virginia. Primarily, we offer substance use services. That's our primary focus, but we also offer a lot of co-occurring services as well as standalone mental health, eating disorder, autism schools in Pennsylvania. That's the service we only provide in Pennsylvania, and then specialize with some services specific for military and veteran populations as well across in our Kearneysville location being one of those locations where we specialize in the veteran services, and hold contracts with the VA. So we'll talk a little bit about some of the key, like kind of our key tenets as far as who we are as an organization. I would say one of our most important approaches to treating the SUD population is access to care. Clinical quality is a huge portion of what we do as well, but we know that the population in which we serve, that time of getting the person willing to come into treatment is so small. And in a state like West Virginia, transportation and having access to services can at times be a barrier based on the number of locations and just how the state is kind of broken down. So we have kind of two folds within our access, and I would add in Tyler as that as well. We have dedicated liaisons that work in all of our communities that can serve as a touch point for any types of questions or support that you would need. We also have a 24/7 manned call center, and that's not a call center in which you call and you're getting an automated response. 24/7, 365, you're going to call that call center and you're going to get connected with a real person that is knowledgeable about our programs and what we do. So essentially at that point, we complete a quick pre-screen. The individual is approved, or maybe referred out for other options if we don't provide it. And at that point, we're setting up transportation for that individual. Our transportation is ideally same day, next day, most of it being same day. And we're getting those individuals picked up by our own transportation and dropped off directly at our program. In addition to that, upon discharge, whether the person completes successfully or not, we are transporting that individual back home as well. You can see there was some facts as far as the number of, we provide transportation across 8 states. We have a pretty comprehensive process in which we are able to kind of logistically figure that out. But we know that transportation and access to care is one of the most important things, specifically dealing with the Medicaid population as well as the criminal justice population. You heard me talk a little bit about the continuum of care all earlier. For us as an organization, that's really important, whether it's with us or other providers. We want to see individuals engaged in treatment for longer lengths of time. So whether they're coming with us for their higher levels of care and then being, as part of their aftercare, being referred out to a community partner, those are our key focuses, that we're keeping that individual engaged in some type of treatment services, including medication for as long as possible, because we know the evidence shows that they're going to be more successful if they're engaged for a longer period of time. We also we hold CARF accreditations as well as all necessary state licensures across all of our programs. In West Virginia, we're CARF accredited. It's a pretty lengthy process in terms of just working directly with the accreditation of CARF to ensure that all of the facility, physical plant, and as well as the clinical programming and staffing that we have are all aligned with that CARF accreditation. We actually in West Virginia, for our first time going for a CARF accreditation, received a 3-year accreditation. Typically that's received when you've kind of been in operation for a little bit longer and you've been more established. So we're really happy to see that right off the bat, we were able to receive that 3-year CARF accreditation. So in terms of our locations, our residential and detox program that's located in Kearneysville is Mountaineer Recovery. It currently is 100 licensed beds. We offer 3.7 withdrawal management there. We also offer 3.7 medically monitored. So typically that level of care is for individuals who maybe don't meet requirements for withdrawal management, but have significant medical or psych acuity that requires them for additional monitoring before they step down into a residential program. We also offer 3.1 services at that location. While we have those services there, in addition, the next facility primarily offers a large amount of 3.1, and that's typically your step down from residential. Individuals are start to able to get back out into the community, start to build some life skills, work with our case management team, and really get them set up for either referral back out into the community or referral into a long-term program. We manage clients with very high acuity mental health services within reason at that location, pretty much as long as it doesn't meet criteria for like mental health crisis. With most of those individuals we can work with. We also maintain and induct on medication assisted treatment. And at that location, we work with all forms of buprenorphine. We're working on the possibility for methadone maintenance at that location as well. We're hoping that's going to come along pretty soon, but all forms of buprenorphine can either be, maintained or inducted upon. We also offer outpatient services. And as you heard me say earlier, we're working on having IOP services coming online there soon.
Excuse me, Tyler.
Yeah, go ahead.
Quick question. This is the first time I've really know anything about these residential homes and housing. Just kind of curious, is this something you're already doing now, or is it possible? But would your organization be open to, or does it provide for like home plans? It could be some of the residential housing could be for home plans for those who are going to be released or been granted parole and they have substance use disorders. Is that something that is possible or actually is being done?
Yeah. So our programs are not our levels of care. So they're parole in other states, as well as I believe in West Virginia, view it as a inpatient treatment setting. So typically they're able to come there. The home plan approval process comes when they got to go to an accredited sober living or a longer term program, or there has to be approval for the home plan in general. But yeah, we work very closely with parole, individuals coming directly from incarceration, or if they're having any type of struggles in the community, are frequently, I would say, probably across the organization, 70 to 80% of the individuals we serve are criminal justice involved, and that's some type of combination of specialty court, probation, or parole. A lot of those individuals, and we work closely with parole to ensure, like, hey, this is the plan that they're going to be looking at following discharge. Each of our programs across in West Virginia, as well as across all of our locations, have a dedicated case management team. So when you're admitted to one of our programs, not only are you assigned a counselor, you're also assigned a dedicated case manager. One of the roles of that case manager is working with criminal justice entities or other types of referral sources to ensure, hey, this is what type of aftercare planning we're looking at. That's a big portion. If somebody comes in, the first thing we're working on with them is a treatment plan, and that really dictates what they're going to be working with in treatment. At the same time, we're starting to develop an aftercare plan. So is the person going to step down to 3.5 and 3.1 and then long-term housing? And that is the role of that case manager, works hand in hand with our clinical team to ensure that that is smooth. And in a case where a home plan needs to be approved or one of those things, are working directly with the agent to ensure that that's taking place.
That's great. So let me ask you on I'm not familiar with the 3.5 level and 3.1. I'm not that familiar with it, but what's the let's say you have an individual who needs a home plan, definitely needs treatment. I'm assuming you all have been approved by OFLAC for treatment center, so that's not an issue. But what would be the length of time that they would be able to, be in residential housing before they have to, reach some level of independence?
So it's based on, ACAM criteria dictates their appropriateness for these specific levels of care. And while in some cases you can expect that it's usually about 30 to, by the time you would complete 3.5 and 3.1, you're looking at around 90 days. It's also dictated by the person. So some individuals' acuity is going to be much higher and may require additional time. And then in some cases it's going to be lower. But it's safe to say if you're setting an individual for services with us, if they're coming in for 3.5 and 3.1, most cases they're going to be engaged in those levels of care from like 60 to 90 days. With the caveat being, if they're in need of a longer length of stay because they're having trouble establishing residency or housing options, like those can be expanded upon. But a lot of it also is dictated by their insurance. So if typically they're Medicaid, as long as the payer, the insurance, the MCO is willing to continue to provide funding for those individuals, at times they can stay longer. I mean, that happens in some cases with individuals that have really high acuity, their time, but that's just in general kind of the typical expectation. But it's all based off of the individual and how long. You heard me reference that treatment plan. Once they're able to make progress and ideally complete that treatment plan, that really kind of dictates when they're ready to step to the next level of care.
Thank you.
Yeah. So our second location that was the first program in which we identified in the state of West Virginia, primarily providing 3.1 services at that location for the male population. Currently, we have a phase 2 that will include some female services there as well. We are also providing 3.5 residential services there. Based on location, that's kind of more geared for individuals that are much more medically and physically physical health like stable. Just based on the location, it's a little bit further from immediate medical care. So typically if somebody has high acuity for mental health or physical health, they really would want them to go to the Kearneysville location. But very similar services in terms, you heard me speak about the case management services, the medication services, ability to work with individuals that have co-occurring disorders. That 3.1 level of care is really focused highly on life skills. So ensuring there's a clinical component to it, but it's just building life skills, getting them ready for getting back into the community. So kind of like a reentry from inpatient treatment into community-based treatment, whatever that may be for that individual. And then working, obtaining employment, starting to get, if they have vital documents and different things that may be due to their substance use, they didn't have and need set up for. That's what that dedicated case management team for those 3.1 clients is really focused on. One thing that we really value as an organization is just ensuring that the services and the treatment that we're providing is effective for the populations in which we serve. So we utilize a lot of metrics in order to understand if what we're doing is successful. You heard me talk about the importance of access earlier. Some of these metrics, the access metrics. So essentially what this indicates is, on average, we're placing somebody into treatment for detox services within our organization within a half a day. So you heard me talk about that same day, next day admission. For withdrawal management services, which is, high acuity, high risk, we're typically getting those individuals at all times within the same day. West Virginia does prove challenging in its the distance in which we have to navigate clients at times, especially for those withdrawal management services. But in general, we're getting most individuals within the same day. The other thing that we look at is basis 24 outcome. So essentially that is symptomology either decreasing or increasing while the person is in care with us. And there's an assessment tool that we use for that. But as you can see there, the decreases in acuity and the symptom reduction in most of our clients, and this has taken over 12,000 clients. So this is not a small data set. We ensure that when we're working with individuals that they're leaving our services in a much better place. If we were seeing these symptoms increase, that would be a key indicator to us that some types of the services that we're providing are not effective. We also complete routine client satisfaction surveys to ensure the clients in which we're serving are happy with the services they're receiving, and that's something that we do routinely to ensure that the services that we're providing, the environment that we're providing for recovery is beneficial to the client, and they're happy with the services they're receiving. Happy to answer any additional questions. I don't know. Can peek at the chat to see if there was anything there. But really, your primary contact. I know I did a lot of the talking, but just found it really important to kind of talk about who Pyramid Healthcare is as an organization. But Tyler will be your primary contact, and he can talk about what you could reach out to him for. But really, if you need anything, don't hesitate. It might not be something we provide. It might not be something that we can help out with, but we're happy to be just a resource to the community.
Thank you, Tyler.
I do have a question.
Go ahead.
Yeah, go right ahead.
My name is Thais. I don't know if I said my whole name in the beginning, but I'm just so before this position, I'm new to this position here, and prior to this position, I've been in the prison system for 8 years, specifically substance abuse for the past 5 years. I was a substance abuse therapist in the West Virginia prison system. So one of the questions I have for you is, if you said that they can parole there, do you have any current West Virginia parolees from state prisons?
So so we have parolees. Typically, they're coming from the community. That can be something. So in Pennsylvania, for example, we have processes set up with the Department of Corrections in Pennsylvania, which allows them to be released to our care. In West Virginia, as well as most of our other states, those individuals are typically being released out of county facilities into our care. It's not to say that we couldn't establish processes in order to do that, but that would come from potentially a partnership from the Department of Corrections or just different stakeholders that would be able to facilitate that. Typically, it requires, like in the county level, it requires some court orders, some things.
Mm-hmm. Yeah, it's a lot easier.
Right.
Go from
And
county and to any.
Yeah, and it typically is much easier, like to out of county, but something we would be definitely willing to have conversations about our ability to work with individuals coming directly out of state corrections.
Right.
Because
So
it's
you're
something we do.
not confined in any way to, federal prison or state prisons is not an issue. And I think really what Ms. Thomas was kind of alluding to is what I was kind of speak to as well is, there's not a mechanism. And for me, for example, I had to contact an organization that would be willing to, meet with the prison system and, one of the issues was that the person was not on Medicaid, and really the prison system is supposed to get
Mhm.
them on Medicaid, and 9 times out of
Prior
10,
to
they're going to be
really.
eligible. But oftentimes I've had to remind the reentry coordinator in the prison, can you get him on Medicaid?
Mhm.
But the organization that I was able to reach out to said that they would do that. If he comes out to them and he's not on Medicaid and he qualifies, they would work to get him on Medicaid. But they really should be. But I know you probably don't have this in place now, but you'll be willing to work with a prison to let them know that this is what we offer. We're willing to accept this person and so forth. And I think that kind of along the lines of what you were talking about, Ms. Thomas?
Yes, but I also I wanted to see if they could release, if you would be willing. Now, I do know for West Virginia State prisons, you have to be WAVAR. You have to have WAVAR certification, and that is, I pulled it up just.
Well,
That's the West Virginia Alliance of Recovery Residences, and they won't parole unless you're WAVAR. They won't parole into your facility unless you are
but that's
WAVAR
only, but that's
certified.
only, that's
That's
only,
prisons.
that's not for treatment centers.
Correct.
Right. Oh, okay. Okay.
So
Yeah,
if
so
you're
So
there,
that's just the residential. Because
OFLAC oversees the treatment centers, and
okay.
then WAVA is dealing with sober living facilities and so forth.
Yeah, sober living. You're right. I just wanted to see, just because I'm still in contact with a lot of the people. I've worked with them a large portion of my career. So,
and
this job that I do now kind of flows, they flow my
I,
way now.
and
So,
I'm sure Tyler would love to connect with you to answer
okay.
your Medicaid question. And it doesn't have to be the same process, but typically part of that referral process from like the reentry, the social worker, whoever's working with that individual while they're incarcerated, is just verification that MA application has been completed.
Okay.
We would be more than willing to pilot referrals in a small, like if we identify like one place in which we wanted to start it and just kind of see how it worked before we roll it out, say statewide. But essentially we have for criminal justice, for people incarcerated, we have a very brief assessment that the counselor or social worker or reentry worker completes with the individual. They send that over to us. If we can get that from state corrections, if we can get the verification that an MA application has been completed, we can get that client scheduled. And if that becomes a barrier, we can look at other solutions because, to your point, 99% of them are going to be candidates for Medicaid. So even if they come, Medicaid is typically retroactive. So even if they come and then it's not active right away, we can definitely work with those individuals and come up with solutions in order that it's not a barrier.
Yeah, that's good. Yeah.
Yeah.
The way the gentleman that I helped just recently, basically, I made contact with him and so forth. I contacted an organization here in Charleston. They said that I had to have him fill out an application. Well, that becomes difficult because, getting an application there and so forth. But in any case, um, I I helped the individual fill out the application and I sent it to the organization. They reviewed it and they accepted him. They said that we would accept him, and then they made contact with the prison, and so the coordinator there knows that they do have a place that has accepted him, and they had to send the prison an acceptance letter. So they have an acceptance letter. So that's the kind of the process that I was referring to as well.
Yeah, and I actually failed to mention this, and I definitely should have. Within our call center and missions department, we actually have a dedicated criminal justice liaison team that works specifically with state corrections, county, and in some cases, individuals that have recently been released from incarceration. So there's actually specific people within our team. Those referrals go directly to that team, so that they can build rapport with the jails, the social workers, whoever it might be over there, and any issues that arise, they're able to kind of problem solve that. And like I said, we work directly with Department of Corrections in some other states as well. So it's definitely something, I'd encourage anyone to reach out to myself or Tyler, and I'm sure Tyler will probably do some outreach following this call. But would love to talk about, how we can be a resource for those individuals coming out,
Yeah.
especially with the risk that individuals coming out of incarceration are sometimes, those WAVAR programs, those long-term programs are great services for those individuals. But in a lot of times, those individuals need a higher, like that you heard me talk about, that higher acuity of care, can be really beneficial for them to get a really good base to their recovery. And then what we do is we partner with those longer term programs to get those individuals engaged in those services following the treatment they're doing with us, as well as coordinating with parole or whoever the necessary entity is.
So for sober living, I mean, are you currently WAVA certified?
We do not provide, we don't provide sober living. The 3.1 programming is similar to a sober living. However, it's still structured. It has a significant clinical component when you compare it to what an individual receives at a sober living program. So we partner with sober living. So one thing that Tyler and the other representative that we have that's closer to the facility, their role is working with sober living entities, ensuring they're WAVAR certified, ensuring that they're programs in which we feel good about, and we know those individuals are going to be successful in, and then coordinating referrals to that. So that you heard me talk about that case management role. A large part of that case manager role within that 3.1 is identifying appropriate, accredited sober living for individuals to step down as a follow-up to our treatment services.
Okay. Anyone have any other questions? Just to be clear, so you don't provide it, but you do refer, you look to, at the point in which sober living becomes an option or something that is necessary, you do look to refer them to a certified location that can provide for that service.
Correct. Every individual that leaves our services receives a discharge management plan that includes housing, ensuring safe and sober housing, treatment services, medication services, can also include mental health services, and in some cases, referral to ensure that they have a PCP. So every individual that is leaving our program, we're setting them up for all of those services. And typically the most important one out of that is safe and sober housing, ensuring they're going back into a safe environment.
Right.
And one thing I'd like to add, Reverend Silva, is the fact that I have had quite a lot of time to be able to build relationships with the sober living houses throughout the state of West Virginia. Working in this field prior to working for Pyramid and still working with Pyramid, I'm making new relationships daily. But in those relationships, we really get an opportunity to find out the inner workings of all of these sober livings, what to expect, what their curriculum entails, everywhere from cost to smoking, non-smoking, whatever it may be. So that way we can ensure that our clients who are discharging from our facility, or even clients who I get calls all day long to find a placement, and sometimes our facility might not be a good fit for a certain individual. That way, where we've built great relationships with all of these other facilities and programs and sober living houses throughout the state, we have the opportunity to provide a form-fitting program or sober living for each individual to raise that probability of them being able to finish that program and stay and be comfortable while transitioning.
Right. Very good. By chance, are you all contemplating expanding to, say, Charleston, West Virginia?
I don't ever roll anything out. At this point, we're focused on really developing the services that we have, but typically our approach as an organization is, we go to where the need is. So If individuals on this call feel in any area which within the state, there's a significant need for these services, more than happy to have conversations and talk through some of those things. But, I don't ever rule anything out. Currently this is where we've kind of gotten established, and typically in entering a state, we like to keep our services very like within one area. We can kind of problem solve some things and any things that we might be running into. But I would definitely not rule it out. But I would encourage anyone, if you have strong feelings or want to have discussions about need in any part of the state, we're happy to talk through that.
Very good. Yeah, I think it's definitely Charleston would be an ideal location. Hedgesville and Kearneysville, they're a good distance from, they're close to some prisons, certainly, but then on the western side of the state, because it would be hard for some individuals who are looking for home plans to want to go that far east. So that's why I had mentioned Charleston as a, something to consider anyway. But that's why I asked.
As a new person navigating West Virginia, I quickly learned it can be difficult to navigate around the state. So,
Yeah.
and that's for me. So,
Yeah.
think about somebody that has, limited resources. It definitely can be a barrier. So, and that's really our goal, is always, if there's a need or a barrier to services, we want to talk, and we want to either, get the person where they need to be, or if it's something that, we can provide ourselves, we're happy to have those conversations as well.
Yeah. Well, I had to work with one person, and he ended up in Morgantown. That's not exactly where he wants to end up, but I mean, that was all that was there.
Yeah.
But he was incarcerated up in Doddridge County, I think, at the time. So it wasn't that far off, but that is an issue. We have so many prisons from all around the state. Someone's looking for a home plan, but also SUD programming.
Mhm.
That the option would be to go to Kearneysville or Hedgesville. Could be a challenge that they might well do it, but then when it comes time to be released, then where do they go from there? But
And in those cases, we provide, and that's where Tyler and our team in coordinating
Right.
services back,
Right.
and also provide transportation to get
Right.
that individual back.
Right.
So it
Right.
can be challenging, but it definitely is something that we're willing to assist with. But it does present challenges.
Yeah. Well, I want to thank you, Tyler, both Tylers, for your presentation, and it's encouraging because to hear of an organization that's coming to West Virginia that's providing this amount of housing for residential for substance use disorders is very much needed. As you know, it's very much needed in this state. We've been hit along with other states, hit badly in these areas, and so many that are incarcerated or are on parole and so forth. They're dealing with substance use disorders. So we're very encouraged to hear this, and it's going to be helpful for me as well. So I want to thank you so much for your presentation. And Tyler Pack, if anytime you need to reach out to me, if you need some help in certain areas, feel free to give me a call. I put my email and my phone number in the chat box, so feel free. And of course, Krisha is a good resource as well.
Absolutely. I really appreciate that, Reverend, and I appreciate that, Krista. I do just want to encourage everybody who got the opportunity to be here today. I just want to say thank you and encourage you guys to please never hesitate to reach out. I've got my information in here. And I've always got a phone on me. I'll feel free to reach back out to you immediately, and we can problem solve together if it's a question about our facility or just a general question at all. I'll be more than happy to assist any way I possibly can. And again, I just thank you guys for letting us come in today to be able to provide this information for you.
Great. All right. Well, our next meeting, we meet regularly on the second Wednesday of every month. So our next meeting will be February the 12th, Wednesday, February the 12th. And it's on Zoom. And if you need to have your email address added to our email list, please let us know and we can do that. And I know I had to add someone to the list that was looking for the link this morning. So we can add you to that list, but February the 12th, the second Wednesday, we'll meet again. And so again, thank you so much. If anyone has any last minute announcements before we head out, feel free. Any announcements?
I'm gonna drop the link here in the chat for everyone to join the council. So it's easiest actually if you add yourself, because there's a lot of fields that are required. So to save back and forth on emails, just join that, fill out that link right there, and you can join multiple councils. You can join all of them across the state, just ones that are applicable to you. But I just put it over in the link there for you to add yourself.
All right.
And then
Kenneth,
several of you, I've sent an email out if you want to present at any of the other councils across the state. Just let me know. I sent several of you an email, so I'd love to see you at other councils.
yeah, there were definitely some other councils on the eastern side, at least, that would be very interested in hearing you, hearing about the pyramid. So, and Kenneth, also thank you as well, and we wish you well in the next month. Well, really in the next weeks ahead for all the training that you've got set up.
Thank you. I look forward to it.
All right. Well, everyone have a great week. Keep safe out there, and hopefully see you again.
Thank you, guys.
Okay.
Thank you.
All right. Have a
Thank
great
you.
day.
Have a good day, guys.